All right, hey everyone, welcome back to the Barbell Medicine YouTube channel. I'm Dr. Jordan Feigenbaum. This is the question and answer part one from Brooklyn. So this was last month here with Baraki and I. We're going to get into that here in just a few moments, but I figured since we're kicking it back old school to Brooklyn, let's use my favorite intro yet in case you guys haven't seen it. Alan, how do you dance to this song?
I always like to dance just like Style Mine. Where you bend your knees, push them side to side, put your hand like this.
Is there a different amount of sodium intake that is recommended for people with high blood pressure? Currently, the recommendation is to decrease salt intake and therefore sodium intake for folks who have diagnosed hypertension, especially if they're on medication. That being said, it would be irresponsible of me to suggest that folks with hypertension take in more sodium, despite what Stan Efferding will tell you. The idea is that we have good data that if you reduce your sodium intake and you have high blood pressure, that your blood pressure goes down a little bit. Just like we have good evidence that if you increase foods that have potassium in them, fruits and vegetables in particular, and you have high blood pressure, that your blood pressure improves. I don't think people need to take potassium supplements, right? And I don't think that people who don't have high blood pressure necessarily need to worry about the sodium intake. But given the high prevalence of people with high blood pressure and that the fact that half of the folks who do have high blood pressure don't have it treated to goal, it seems it'd be irresponsible of me to say salt doesn't matter, because I think it does matter a little bit. So I wouldn't recommend that people who have high blood pressure add any additional salt to their diet unless there's some special case, but just not in general. Is there a way to quantify fatigue?
So fatigue is a super complicated phenomenon with lots, hopefully as you gathered through the lectures, that fatigue has numerous physiologic components, has psychological components, all of which are interacting, and therefore it should make sense that it's difficult to measure fatigue in a valid, i.e. accurate, and reliable, i.e. repeatable way, particularly in a way that will be useful to guide management decisions in your training. So you measure some value related to fatigue, and that tells you, what do I do with it? So the best that we have that we tend to use is by observing, basically using some metric of performance at the time to then guide what you do that day. There are lots of other methods out there, people who will use certain techniques. You may have heard of like people who use heart rate variability monitoring or Mike T's track system, things like that, that attempt to quantify to varying degrees these different components of fatigue. I've not personally used the track system, but I think it tries to measure more of the components. I think using HRV as a way to guide management decisions in training is probably incomplete and potentially harmful, insofar as you may get a value that does not perfectly correlate with how you're feeling and performing, and you may make inappropriate changes to your training based on a number compared to based on how you're actually feeling and performing. You know what I mean? So that's why we don't generally recommend using that routinely to guide, decisions about how many sets am I doing, how many reps am I doing, things like that. There aren't any validated blood biomarkers that you can measure to tell you, like your CK levels or some other muscle enzyme or some inflammatory molecule, CRPs and stuff like that, that we have people that come to us telling us that they got measured, not useful from like a fatigue standpoint and not useful for many things that they think they're useful for outside of specific disease states. So I think that our preference is to use some metric of performance that is repeatable in the gym. For example, the single at 8, that we use a lot. or some other performance-related metric versus measuring things outside the gym that will likely not capture the complete picture of fatigue from a biological, from a psychological standpoint. Yeah, I think that's probably...
Yeah. Well, it couldn't possibly capture enough for the psychological component. So I actually don't... Not only do I not think there are any available tools right now that are valid tools for assessing fatigue, I don't want to find one anymore. Because there's no way to encapsulate that psychological sort of component without many threads of bias in it, right? So the latest thing that's taken the fitness industry by storm is the Whoop watch. It will tell you how much you slept, how stressed you are, and therefore what you should do with training, except for there's not this huge data set where they're pulling these recommendations from. It's just a meaningless number that you get. It's your Whoop score. And then if it's high or low, you should theoretically adjust training by how should you adjust it? No one knows. And just think about it. You woke up and your Whoop score is 50. That's low, all right? And you say, I guess I don't feel very well today. That's noceboed you into underperforming potentially, right? On a day that you might have otherwise had a PR because you don't know. So in that regard, I'd like to be naive. The idea would be that knowing the fatigue number would somehow alter your management to improve an outcome. And I don't think there's anything like that will be able to be developed because there's the human error in not only responding to questions, but then also assessing those questions. So the answers to those questions. So so there's nothing right now that will do that, and I don't want to know. Just like I don't want to know if my rotator cuff is torn because
you can use your arm.
Because I can still press.
So
bench. Yeah, and do muscle ups and whatever. And if that changes, then maybe I'd want to know if I had some other symptoms. But you don't want to just go looking for a problem and create it without a solution that makes sense. So
other people want to help you find a problem,
yeah,
particularly when they can
make some money off
it, right?
Yeah, I want to create a problem that didn't exist before, make some money off of it, and then offer a solution that we just made up.
Yeah.
And hopefully you're not smart enough to realize that we just made it up.
Like low T clinics.
Low T. Do you have low T? Have you ever been tired? Have you ever felt like you're not as young as you once were? Have you ever failed a set of 5 on a terrible program? Well, you could probably benefit from low testosterone. Let's check your testosterone levels the wrong time of day, inappropriately prescribe you something you don't need, and hopefully we don't have to see you very often because that doesn't work with our business model. We just want to get
that happens a lot.
Yeah.
So, all right.
The question is there a benefit in increasing strength in the context of pain management?
So I think I touched on this during the talk because I think there's a common misconception, or people get told a lot by various therapists that this hurts because this muscle is weak, or you hurt because you are weak. That is generally wrong to be telling people as a mechanism to explain their pain. And similarly, I would say that the absolute pre and post strength levels before your strength training intervention and after your strength training intervention are not going to be predictive or correlate with the pain improvement they experience. Therefore, the absolute strength acquired over the course of that training, it itself is not the mechanism of benefit. So I would certainly agree that, hey, people with these issues often can benefit from including strength training, not in isolation, but in combination with the pain education stuff that I did with everybody, potentially some other treatments if needed, like if they have uncontrolled depression, you're not going to be able to get them to train in the first place. So you have to deal with that too, right? So it's complicated. So training is one part of the puzzle in treating this stuff. It can certainly provide benefit. The mechanism of benefit, I would argue, is probably not related to the strength itself. And I would not suggest that to the person. It's the process of training. We don't even know how it works, right? We've just had this observation that, hey, movement helps, exercise helps. But the specific mechanisms, difficult to fully elaborate. And there are probably numerous mechanisms operating at multiple levels in the brain, spinal cord, peripheral tissues, things like that. So yeah, the strength is great. We like being strong, but I don't suggest that the strength itself is what makes pain go away. People say that, like, strong backs, strong backs hurt less than weak backs. That has not been my experience in dealing with lots and lots of people who have pain.
Yeah, I mean, so people are like, the strongest power lifter I know doesn't have back pain. It's like, yeah, well,
consider the strength level of the general untrained public. It's pretty low.
Yeah, it's good to train, but the strength itself is not the differentiating factor. You can take a huge sample of the population, and I wouldn't be surprised if pain complaints put up against some assessment of strength level were less clear than might be predicted by people who are very biased towards strength being the mechanism of improvement.
Yeah.
I would disagree with that being the way that it works.
I only have one study that I'm thinking of that actually compared rating of low back pain against powerlifters against their age-matched controls, and it was a little less in powerlifters, but the sample size was low, so it wasn't big enough for me to know anything about.
Yeah.
And then the other thing, I just want to know why that is a pervasive thought. Being stronger helps with the pain. But I do think the movement is the unique component. Overcoming fear, and then self-efficacy, and sort of not necessarily, like I said, not being afraid. I think it's probably
I think a lot of those are some of the ways that it helps. I think the idea that that's how it works is probably so pervasive because you have pain, you start exercising, particularly using your preferred modality, strength training, you get stronger, your pain improves. What's the apparent logical way that this worked? The strength was the difference. Yeah, all we did was get you stronger. No, you did so much more than that. So many more effects on the brain than just getting their low back muscles stronger, right? Because again, if it was the strength, then pain would be an even bigger problem than it already is because of how few people, already train. So I think the mechanisms are probably far more in the neurological, psychological side, social side, particularly if you're training in a supportive environment, lots of friends, people, you have a trainer you trust or a coach you trust, compared to the absolute pre and post strength levels. So,
I don't have anything else.
All right.
Will there be a barbell medicine novice program?
Question is, I got so nervous.
Was it expensive whiskey?
Nah.
Can I have a towel? The question is, will there be a barbell medicine novice program? Yeah. So but hang on a sec. Think about this. More importantly, can I have whiskey? What I need more now. That's right.
Yeah, I spilled my coffee earlier. You spilled your whiskey.
Yeah, this floor has been through some stuff. Sorry, floor.
It's probably had worse things on
It's
it.
definitely, it's been across the gym. All right, so
Sweat angels.
let me rephrase that. Thank you. There will be a barbell medicine program for people new to training, but I probably won't call it a novice program outside of marketing reasons, and it won't be a linear progression. Here's the rationale. The idea is that we want to start people who haven't been training much before and put them on a path towards long-term development. And so that's not going to be linear. The development's not going to be linear, and I want people to be able to grow through the program, naturally evolving into some post-novice programming. And so if the novice programming looks so much different than the post-novice programming, you got to need another program to bridge that gap. Hence the bridge, right? Is meant as a stopgap, to transition people from, okay, this stuff has multiple deficits that we want to address. Let's do this quick thing, and then you can go into other programming. So I think that our, beginner, whatever it ends up being called, beginners, or you can call it a novice program, will end up looking a lot different than current offerings. That being said, I'd like to reiterate that I still don't think it matters what you do in your first 3 months of training outside of improving someone's commitment and self-efficacy to go into the gym on a regular basis and, training.
And skill.
Yeah, well.
Which is still a long-term thing to develop.
Yeah, exactly. I would make the argument that I don't care how well their squat looks at 3 months unless that is the outcome that we're seeking. You know what I'm saying?
If that's when you're making the determination as to whether a program is successful or not.
Correct.
Right.
Because if they're never going to go to a powerlifting meet, I may never care what their squat is. If there's
the weight.
Yeah.
I thought you meant the technique.
Oh, no. I mean,
Yeah.
It's arbitrary. We're just on this floating rock, moving arbitrary weights and arbitrary movement patterns through space. So,
It's true.
All right. The question is, do we like the Starr Protocol, or do we have a specific rehab protocol for muscle belly tears? My answer on this is it depends on the grade and how big the tear is and how much dysfunction you have. I wouldn't recommend any protocol other than just train. Well, because if you have a muscle belly tear that you're able to train fairly normally, even if you take a little bit of weight off the bar, I would just do that. Because there's nothing special about the sets of 20, 5 sets of 20. There's nothing special about ignoring all other training development processes that were going on before the tear. If anything, not doing the other things that you were doing before is going to detrain you during this period where you had a muscle belly tear, right? So the Starr Protocol is do 5 sets of 20 at ascending weight, do it every single day, but don't do anything else. And I'm like, wait, don't do anything else? Well, that other stuff's going to detrain then. So if it were me and I could actually train somewhat normally, let's say I tore a pec, then I would try to bench press. And if I can do the bar or a little bit of weight for whatever sets I was supposed to do, I would do that. And I would do the rest of my programming normally. I actually don't think that the Starr Protocol is that useful. And I also think it gets misapplied a lot. Because people are like, I hurt my lower back. Is this a recommendation should I do the Starr Rehab Protocol? It's like, well, one, that was a non-validated approach to a muscle belly tear. And you're not tearing anything in your back when you have that. And the idea that doing 5 sets of 20 repetitions on the exercise where the tear happened, that's somehow uniquely beneficial to reducing the muscular damage, I don't see it. I think the worst thing that somebody could do is not train. It's probably the worst thing you could do, or the detrain in some significant manner. And the other thing I would say to that is ignoring reasons why the thing tore in the first place. So what we're saying is that too much acute fatigue has likely been induced upon the person, which caused the tear. That's the most, do you have anything to add to that?
Yeah, I think it's if you have a muscle tear that does not have significant dysfunction afterwards. In other words, not a complete tear where you can't move the leg or the arm normally afterwards. I think it's a fine thing to do. I don't think it's a magic thing to do. That's I think probably the point that we're getting at is if you were to go in the gym every day afterwards and do some other set and rep scheme with progressive loading, and you were to compare the outcomes of these things in some sort of a research study, you're probably not going to see any significant difference in outcomes. So the point is that you're getting back to you're adjusting. It's basically load management, which is the name of the game in managing injuries. That's like what I was describing when I talked about how to deal with injuries earlier. That was load management, not just load in terms of intensity, training load, right? And so, is there something magic about 5 sets of 20 compared to
that's the way we always did it.
3 sets of 10, or 5 sets of 10, or 6 sets of 15, or I could make up any combination? No, I think it's probably just the training, the movement, and I wouldn't make claims about necessarily about like blood flow and stuff like that. I would just say that training tends to help things get better. So if you suffer something like that, if you want to use that method, it's fine. You could probably do something else, and it's fine as long as it consists of intelligent training. And definitely look back over your training log to figure out, is there some thing that I can point to that might explain why this happened, that I cannot do this again? Make sense? Yeah. All right.
the question is about calorie deficit. Like how much is too much? What's the wiggle room? I actually start lower than that. So here's the reason. I think most people, when they report their calorie intake to me, are underestimating what they're actually taking in. So my Hassan's in the back of the room this time intelligently. He's moved from the front. But in the example, if he told me that he was eating 2,500 calories a day, I actually expect that to be higher. One, there's multiple well-done, well-performed studies when they ask people to log and how many calories are you eating on a daily basis, and people underreport very frequently. So I think that they're underreporting. So if I make a 500 calorie drop, I expect that actually ends up being more closer to 700. So most of the time I'll make a smaller change just to see if I can get away with it. But I change my stuff based on the results, based on the empirical sort of, are you losing? If you're not, change, as long as somebody's being compliant. If somebody can't comply with the diet, you got to change the diet, right? Or maybe it's not a good time to be on a diet. That's my take. That make sense? Yeah. Question is about reading Rainbow. No, the question is about reading recommendations.
Is this specifically for programming or for any other topics?
For programming.
For programming, all right. You probably have more.
Well, okay, so for programming,
but I did, so for the tubes, I guess, the question was specifically citing my recommendation that people read John Kiley's.
Yeah, John Kiley's stuff's great.
So would recommend to the tubes, read John Kiley. God damn it.
I thought I was going to fall. I was going to sacrifice my leg with the whiskey.
I have to cut you off, bro.
Look, I am already. Yeah, this is what happens if you don't drink. So John Kiley's stuff's great. I think if you're looking for books, the Renaissance Periodization book on strength, scientific principles of sport strength.
I think it was from Juggernaut, but
Yeah.
Israel was on it.
Yeah,
I think it was
Sposer. That's pretty good. I like Science and Practice, Strength and Conditioning, second edition. That's Zatsiorsky. I think those are two of the books I would probably recommend. And then after that, so much material is on the internet that I actually wouldn't recommend any other books with respect to training and programming. The strength is specific, the specificity of
Chris Beardsley's kind of putting together kind of a nice model of
on Medium
description, describing this stuff. He actually has like a $2.99 ebook called Strength is Specific that you could look into.
Yeah, that's Chris Beardsley. He's got a bunch of articles on Medium.com. Also, his ebook Strength is Specific. That's a really good read. Greg Knuckles' stuff is great on this stuff. Admittedly, these are guys that we agree with, so you're getting sort of a biased look, I guess, theoretically. Although this is what the science says as far as we know. Ultimately, science has compelled us to come to these conclusions. It would be easier and more advantageous from a market perspective to just, make stuff up or agree with other sort of attractive exercise options. But we felt compelled to follow the research and now ended up on Barbell Medicine Island. And glad you guys are joining us here. It's quite nice. But
yeah, I mean, we kind of had this, it's just what's called in the psychology world as cognitive dissonance. We saw a lot of this evidence and data on stuff, and we were in this uncomfortable position of, what do you do with this? And then we said, well, we have to change our minds on things. And so that's...
Oh, the other thing I would have you read is Science of Running, which actually, you're like, what? Running? I don't want to run, bro. But honestly, that's...
Magnus?
Yeah, Steve Magnus. Great book. I think that would probably be a great start. Should keep you busy for a little bit. And then you'll just start looking up other things. Anything else for reading? Matt Perryman's Squat Every Day is a free ebook. I thought that was good, not because of the program, but just the line of the thinking behind it. It's good.
You guys gonna write a book?
Yep.
Yes. Probably multiple.
What's that? Try. Yeah. Well, first we're gonna write Ending Strength. Yeah.
The hospice edition.
Yeah, basically what you can squat at age 65 is directly tied to your mortality,
rate because you take 5 pounds off every week. So the higher you start, the longer you last.
It'll probably be multiple just based on different topics because you obviously, you guys got the fire hose of content this weekend. And to put all that in one book and actually address it to the level of detail that we would want to would be 1,000 pages. So it'll be split up into stuff probably related to training, related to health, related to injury, stuff like that. So we have some exciting stuff coming for sure.
The question is, what's up with the bridge? All right, so here's what happened. I had a marketing guy to say, hey, you know what you should do is you should write an ebook. And I said, that makes me feel bad. I don't want to do that. I'm not a Fitspo person, And he said, well, fine, do something that you feel like what is needed in the community right now. And I said, you know what? People are ending the novice program, and then they have to go out into the world of intermediate and advanced programming and select something, okay? And hopefully they've made the right decision. Maybe I'll just make that solution easier for everyone. So that's what we came up with. The idea was we knew we needed more volume than the novice program. I know we wanted more exercise selection. I know that we wanted to have people auto-regulate their training so that the effort level was controlled from session to session to session. And we wanted to give people experience working at different average intensity ranges. That's why you see repeat sets of 8 throughout the thing. That's why you see singles at times. That's why you see sets at 9. And we wanted to also improve skill across the exercises that people valued. And we knew that was squat, bench press, deadlift, press. That's why you don't see weird stuff like, it'd be weird to have trap bar deadlift in there. People be like, well, I don't want to trap bar deadlift. I'm like, well, why not? And they're like, because it's not a good exercise. And you say, well, why not? I don't know. And so we're like, I don't want to fight that battle. So we kept the exercise selection more narrow than it could have been. So we view the bridge as a bridge from starting strength novice LP to what we would consider post-novice programming, where you would have an emphasis placed on conditioning where needed, movement variation when appropriate, auto-regulating your own training, and has an increase in volume because we know that the lean body mass improvement is very, very important. Contrast that to something like the Texas method, which doesn't have an increase in volume, doesn't have an increase in exercise variation, doesn't place impetus on conditioning, doesn't place any importance on self-efficacy through evaluating how hard each session was. And I think that's the wrong choice. And I wrote an article about that called Into the Great Wide Open, which at one point was accepted and said, yeah, of course, we never recommended Texas method. It was always the 4-day split. But as soon as you say the Texas method's bad,
It's like the Joker. Everyone loses their mind.
Everyone loses their mind. It says, you guys got to get out. So here we are. I think the bridge is a good program. If I had to do it over again, I would have just sussed out my version of a beginner's program and just done that instead. So what I told Austin a few weeks ago was that at that point I was 20-something pages deep into the novice ebook.
Meanwhile, I had started editing the bridge because there's a bunch of stuff that we need to edit in it.
Yeah. And he goes, what? You didn't tell me? I go, no, man. Let me do my thing for a little bit. So, I probably would have made that. If I had to do it over again, I would have made that. I would have changed some variables in there and made that the beginner's program. But I still think if somebody's on the novice progression right now and they stall, by evidence of their weights aren't going up on their work sets, you should just go to the bridge. I don't think that a reset is appropriate unless you're a over-performer on the novice linear progression and you have a great success rate with that, in which case, sure, you can reset and try it again. But otherwise, if you've stalled, move on. Go to the bridge. It's a better program.
Yeah, I think I can reiterate this for everyone else that'll be watching this, because basically Jordan asked who would I do a reset for, and I think we talked about the spectrum of training sensitivity, athletic spectrum, the people at the far right end who respond profoundly well to training, who end their LP, upper 300s, 400s and beyond. Sure, reasonable to do a reset in them. They've demonstrated they respond very well. People with a subnormal response, i.e. training resistant, i.e. they finish their LP squatting, under, say, 250, I suppose. I don't know, I just made that number up, but anything subnormal, I have a harder time justifying doing a reset versus just moving on, because they've already proved that they don't respond that well to it. So why keep exposing them to the same thing they're not responding that well to?
Got to keep it simple.
But
You don't have to do that.
No, you don't have to do that. And in fact, the argument for simplicity is wrong, because if it was simple, you would expect a higher rate of compliance than 2%. But you don't have one. And the other thing is, look, hey, if someone finishes LP with a squat of 405, 3 sets of 5, that's their last successful LP session, what do you expect them to squat in 4 years?
I would ideally expect them to squat quite a bit more if they were trained
600 at least.
years later. Yes.
And if you're not,
we got problems.
we have problems with management of training post LP. Or you've made significant changes to the actual linear progression, such that not only is it no longer the novice linear progression, but where you ended LP, that number is now irrelevant. So what I'm getting at, if the average end of novice linear progression is 280 pounds, and you're way above that, and yet you underperform the rest of your life, then something's wrong with that situation. Oh, sorry. The question is, when do you know when the end of novice LP?
No, when do you know they
Oh.
not working when you want it not?
Oh, I see.
In post-novice training, when do you know that a program has stopped working? That's the question.
Intermediate or advanced.
So it's going to depend on your goal. If your goal is just getting stronger, then I think using an estimated 1RM or some other strength metric that you're tracking at every session is good. So you could use, a set of 5 reps at a hard effort, a hard set of 5 for a given week, hard set of 3, or estimated 1RM. You could use any of those things. And if you see the trend is going up over time, you are reasonably sure that, hey, things look like they're working. My stress is producing enough fatigue such that my fitness adaptations are increasing, that I think my performance adaptations later on are likely to occur as well. You're hedging your bets, right? If you don't see any of those improvements in a post-novice person after 2 weeks, and that continues to 3 weeks, certainly by 4 weeks, this is probably not working unless something else is going on and you already knew that. You're like, you know what? I started a new job. My girl left me. I'm, doing all this other stuff. There's too much noise to interpret this data. But without any other acute change, then, you're left to say, well, nothing else has changed. In 4 weeks, any metric that I could possibly conceive is accurate, isn't improving, I got to change. And I think our first, you'd have to do, we do what are called block reviews. You just sort of, at the end of a training sort of block, you say, all right, what do you think? How do you think this worked? How did your numbers change? What was the best part? What was the worst part? Let's get some feedback. And you try to make your best judgment off of that. So I think that for most folks, even in the advanced realm, 4 weeks is probably the most I would go before I'd be able to say, this isn't working. No? Nothing else?
Okay.
All right, so the question is, GOMAD, what's up with that? So the idea behind GOMAD, gallon of milk a day, is that there is some intrinsic or unique benefit to drinking all of that milk. And I don't think that's true. I think that if you were asking for a transportable, cheap, widely available resource of calories in the United States, then milk certainly fits that bill. It's got a great protein and amino acid profile. It's got carbs. It's got fat. You'd be hard pressed to find a replacement that's all in one, again, easily portable, easily available, cheap resource. However, there's nothing special about it, really. It is calories, but it also, it's a good source of protein, but you could get the same if you wanted to eat chicken and, some potatoes and some peanut butter for your protein, carbs, and fat. If you're asking me if the same amount of calories from milk is better than chicken, potatoes, and, peanut butter, I can't say that. I think that if you're going to undereat and you need to gain weight, and the only way that you're likely to meet your calorie goal is to drink a lot of milk, then drink a bunch of milk. The other thing I'll say, because they're going around on the internet, is that milk is bad. It's just filtered cow's blood. That's what. See, this doctor busts all the myths about milk. Tune in tonight at 9. But it's 8 o'clock. What do I do? All right, so there's nothing wrong with drinking milk either if you like it. All right. In fact, if you look at some evidence out there that the people who drink the most or consume the most amount of dairy products tend to have the highest amount of lean body mass and lowest amounts of body fat in the United States. So that's reasonable. But I don't think you need to drink a gallon of milk a day. You certainly, if you wanted to have whey protein, that's fine. But I don't think you need milk. Do you like milk?
Not really.
Well, look, man, I don't drink milk. And I'm not saying do what I do, but there's nothing uniquely beneficial about milk that you can't get in another.
There's no like micronutrients.
Well, those you can get those elsewhere in a mixed diet anyway.
Right. I mean, I can argue on both sides of the deal. If I'm arguing from the side of you should be drinking milk, I'm saying, look, man, you can't find something that's got protein, carbs, fat, sodium, and vitamins, micronutrients all in one source that's portable, easily available, and cheap. And I say, well, that's true, thanks government subsidiaries. However, I can get all those things from other food sources too, which is true. So I don't think that you need to drink milk in order to live a full and complete life under a barbell. Yeah. But if you wanted to drink milk, you could. Yeah.
It's useful from an adherence standpoint. The rest isn't magic. I think that's probably how you could summarize it.
Yep, I agree.
Yeah.
The question is about acute onset food intolerances, specifically chicken and eggs.
Yeah. I can't say that I have seen cases of this where I was particularly convinced that all of a sudden someone became intolerant to that particular food. In other words, if somebody complains about now foods are running straight through me, they're making me not feel good, whatever, I'm going to start looking for other reasons as to what could be going on, not blaming like all of a sudden you can't tolerate chicken. Mainly because I can't, in an otherwise mixed normal diet, I struggle to come up with a mechanism for that.
Yeah, it would be unusual to just all of a sudden out of nowhere develop an allergy to chicken and egg, even though, egg is one of those food sources that people do have allergies to. So let's say you did have an allergy to it. Well, I would expect other signs besides just some diarrhea. And so if you were my patient, after a thorough workup where I'm like, I don't know, maybe this is an allergy, now I'm sending you to an allergy and rheumatology. Yeah.
Or GI if gastroenterologist if the issue is primarily diarrhea, because there's a bunch of other things that can cause diarrhea that may need invasive diagnostic measures if you follow what I mean.
Yes. Which is interesting because you could potentially mask the diagnosis of something that needs to be treated or should be treated immediately with certain lifestyle or dietary changes. And so if you were a savant on the internet, you might say, well, look, this is common. People with egg allergies and chicken that happens all the time, so just do this, and this, and then you don't have any symptoms, and so you delay workup and diagnosis and subsequent treatment for 5-6 years. That may be a problem. Yet, if you're not a medical professional, there's no recourse for you doing that. So I think that if this has happened to you, I would definitely talk to your doctor or a doctor about this. And I'm, of course, somebody on the internet saying, "Oh, doctors, of course, just want that copay." Yeah, dude. I want to talk to somebody about their food allergy. This extensive food history. This is an intensive sort of conversation. We want to help, but at the same time, this isn't where a bread and butter kind of situation as far as us. But
and Vanessa wrote a good piece for us in the newsletter, RD, about basically dietary variety and kind of like nocebo and nutrition and stuff like that, some interesting stuff. And the goal being that you would be able to tolerate the broadest variety of foods. You'd be able to tolerate that and do well. And so to the extent that you're not right now, particularly for not super allergenic foods like chicken, not something that's particularly allergenic, then I would probably get it looked at.
Yep.
The question was, when it comes to exercise or training in pain, what role does technique play when it comes to pain?
You want to go first?
Sure. I can formulate my thoughts on the fly.
Sure. What's your favorite color? Green. I like green.
So, hopefully, if you took nothing else from that pain lecture, you just understand that pain is an output of the brain, not an input to the brain, right? And because it is an output of the brain in response to numerous inputs and processing kind of events that have to happen in the brain, then you can see how it would be very, very, very oversimplistic to suggest that a minor technical deviation should result in acute pain, right? And if you look out in the world, you see ample evidence contrary to that idea. In other words, have you seen anybody pull a round back deadlift? Ever?
Nope.
Yes, you've
Nope.
seen lots of people do that.
Nope.
Right? And they don't promptly collapse to the floor with excruciating back pain. Have you seen anybody bench with wildly flared elbows? Do their shoulders explode? No. Right? People who fail to shrug at the top of a press, do they complain of acute shoulder pain? No. So it suggests that we are far more tolerant to these sorts of things than might be suggested, right? So we can make a fairly compelling argument for, what we would consider to be good technique on lifts from a standpoint of mechanical efficiency, lifting the most weight, things like that. I cannot make as compelling of an argument for this stuff from an injury standpoint or from a pain standpoint. And that's simply because of how much more complicated pain is, how much more complicated injury is, the definition of injury. I talked about some of the risk factors for injury, some of the strongest ones for injury being things like session RPE, acute on chronic workload ratios, basically the amount of training that you're adapted to versus the dose of stress that you get right now. Those are bigger risk factors for injury than rounding your back a little on a pull, flaring your elbows a little on a bench, not keeping your knees out. I mean, have you ever seen a Chinese weightlifter? Or any weightlifter, right? There are some of those people that touch their knees together when they come up out of the squat. Their menisci should be shredded into bits.
They're probably stretching their meniscus.
And they may very well be torn. And they probably have no symptoms. You know what I mean? Yeah. So our arguments for the reason why we coached you on the lifts this weekend is not to reduce the risk of injury, because we think that you are all very resilient, adaptable biological organisms that can handle a wide variety of physical positions, postures, mechanical stresses, right, without breaking. But you want to get a good training effect, and you want to see the weight on the bar on your arbitrary movement pattern of choice go up as much as possible. And the way to do that is using some form of technique that has been kind of deduced over time in the lifting world. Does that make sense? Do you think that sufficiently answers your question? Yeah. Do you have anything to add?
Not really, no.
You sure?
Yeah, I mean, it's just the same. Just me. It's just hearing myself talk.
All right,
Yeah.
we don't need that.
No. The question is, do you ever recommend gaining weight? Sure. Yeah. But then that's couched within the context. That recommendation is couched within certain contexts. If you're like, Jordan, I want to be the strongest version of myself, how do I do it? Well, that likely involves gaining weight for many people. For other folks, I'm saying, you know what, let's not ask that question. Let's ask a different question, like, how do I become the healthiest version of myself? Because we need to lose weight, So do we ever advise gaining weight? Sure. I don't have, people ask, we do these Instagram live things all the time, and people are like, hey, I'm 5'8" and 175 pounds. Should I gain weight? And I'm like, I don't know. What's your body fat? What do you want to do with your life? I think that most adults who are underweight, who start resistance training, could stand to gain weight for a period of time when they start training. Mainly because the lean body mass gains that you can obtain during the initial onset, like your first exposure to resistance training, can be very, very robust if you allow that to be the case. Now, if somebody's already got risk factors like evidence of insulin resistance, they have diabetes, high blood pressure, some other disease that we know that improves with weight loss, then I think that, hey, you know what? We're going to have to compromise your ability to gain muscle mass because we need to take care of this other thing first. So, how old are you? You're 28. What do you weigh?
177.
177, so you're like 81 kilos or something. And how tall?
5'9".
5'9"? Yeah, so if I were your coach, theoretically, I would have you gain weight, but not rapidly. It would just be a little bit at a time. 1, because you're not untrained. 2, because you're not massively underweight. You know, if you were 140 pounds, this would be a different situation. I might be more aggressive, just like I'd be more aggressive with weight loss with somebody who's 350 pounds, you know, versus somebody who, you know, only needs to lose 20 pounds. So it's just different. And if you were untrained, then maybe my recommendation would change a little bit as well. So you pulled, what did you deadlift today? 140 kilos for a set of 5. That was really easy. Yeah, and you have a sweet beard. So, you know, these are signs that point you're on that training sensitive side of it.
Yeah, we get asked those kind of questions a lot about what should I weigh, and the answer first is always, what do you want to do?
Yeah, what do you want in your life?
You should only pursue, you know, the most weight gain possible if the answer to that question is, I want to be the strongest possible version of myself at all costs, right?
And I don't think that
Which is why we don't weigh 275.
Right. Well, if I wanted to be 275 because I thought that I wanted to be the strongest version of myself with no other concern, then I'd weigh more. Yeah. I'd make a lot of other life decisions that do not coincide with being a doctor,
having to roll into the patient's room.
Yeah, exactly. I'd be in a wheelchair because I'm like, look, dude, I don't want to waste any of my energy on these stupid steps. I'm just going to roll around, okay? I'm trying to rest, keep my RPE low. But so that really wasn't my goal when I started training. You know, I just wanted to get stronger, and I think that weight gain, as far as how much, how fast, and if that should even be a goal in the first place, is a case-by-case basis. You know, so I can't make broad recommendations on that. Actually, and if you said, Jordan, I got a gun to your head, what is the broad recommendation? The broad recommendation is to lose weight. Why? Because the majority of the world is overweight. So
the developed world.
Well, that's true. Yeah, the majority of the developed world is overweight, especially America. And if it's America, then certainly lose weight. You know, and that's an unpopular probably statement, but if you're making me speak in absolutes, then that's what it's going to be. So.
Yeah, population level harm reduction would probably be greater with population level weight loss compared to weight gain. So the question is that most of the people who probably come and approach us for health and training assistance probably are already to a degree bought into what we're doing. So how would we approach people who are not already bought into this?
Sure. Well, do I get an elevator pitch or not? I mean, you know what I'm saying? Like, well, it depends on the context, right? If they see me on Instagram Live, that's way different than if I am stuck in an elevator with them, or if they're at a seminar, or if they're at, you know, a presentation, or if they're watching us on YouTube. You know, one of the reasons. Well, yeah, 100%. Well, one of the reasons why we try to make our message so accessible, and we're not narrow casting on purpose, we're doing this widely on purpose, because we want to catch as many people as possible and make our methodology and our message as accessible as possible. Look, we get it. Not everybody wants to be a super strong, like, I want to go to a powerlifting meet and I want to lift as much weight as possible. I get it. You know, some people, I just want to feel better about myself, look good, move well, and weigh less. And we're like, all right, cool. Well, hey, we've got some information for you too, right? And we think that we can bridge a sort of gap between the medical community and the training community, right? In both ways. We can bring medical information to the training community because they're missing that, and we can bring training information to the medical community because they're certainly missing that. That's our main goal. How do you get people who are uninterested in training and lifestyle change to make a training and lifestyle change? And the unfortunate answer to that is I don't think you can. And further, the secondary part to that is I don't think you should try. mainly because your resources are better spent elsewhere on people who actually have some. They move past the sort of pre-contemplative stage. They're said, look, I'm ready to change. How do I do it? They need people like you. They need people like us. You know, they need like all the rest of you in here to help them along the way. That's where your efforts are best directed towards. It's just like being in an argument on the internet. You're arguing with somebody who has no chance, no inkling to ever change their mind. Why are we spending the time doing that?
Yeah.
Don't do it. But we're still guilty of trying, right? You're like, I have to try. You're like, maybe you don't. You know, so
the question you're asking has to do with how do we affect behavior change, which is one of the biggest questions in medicine. It's the stuff that we get trained to to do the best we can with, because hey, we're trying to get somebody to stop smoking, to change their diets, to maybe get off heroin, lots of other things, right? So, you know, the first step in this process is figuring out where are they now. Right? So if I have somebody who's currently admitted to the hospital because they use heroin and they have endocarditis, they have an infection in their heart from it, right? How effectively can I sell that person on doing low bar squats in the gym for 3 sets of 5 and adding weight every 40?
Just add 5
Can't do it. It's not going to happen, right? And we all recognize that. So you have to figure out where is this person. So if that person instead has been treated, discharged, they're in the clinic now, and I'm talking to them, and I'm figuring I have to triage their health problems. Say they smoke. Yeah, I want to get them to quit smoking. Work on that. Like, what about physical activity, exercise? What are you doing? And they tell me something. Well, I have to identify barriers. That's the key in behavior change, is identifying to what extent, if at all, are they willing to change, and what is the barrier to getting them to the next step. If they don't care, what's the barrier to getting them to care? Once they care, what's the barrier to getting them to do something?
Yeah.
Once they're doing something, what's the barrier that's preventing them from sticking with it, right? And then once they quit, what's the barrier to getting them to come back and do it again? Because this is the standard progression that we all get taught, right? So figure out where they are now, identify barriers, do the best you can in terms of breaking down those barriers, but you have to be realistic with this stuff in terms of figuring out, you know, do I have any hope of convincing this person right now? And if not, then you need to work on a different priority, probably. And so in terms of the implementation of it, that was part of what we talked about in our up-to-date articles. The first one had to do with a bunch of medical problems. The second one had to do with implementation of this stuff. How do you do it, right? And so, like he said, not everyone's going to want to come in here and do a powerlifting, train for powerlifting, low bar squat and bench and deadlift. Right?
Thank God.
But can we get?
Thank God.
Can we get equivalent health outcomes using other types of resistance training? Probably. You think if you came in here and you had them hop on a leg press and use a trap bar, that you could get their A1C down just as much as you could with a low bar squat and a conventional deadlift? For sure. So that's what we talked about in our article, is like, here are the principles, right? And you need to assess what is the patient willing to do, right? So a free weight barbell-based program is going to only attract a small segment of the population. What do you do for the rest, given that the benefits of resistance training are so profound? So I literally wrote a dumbbell-based training program for that article, for the second one.
That sounds pretty good, actually.
I wrote a machine-based training program for that article, so that doctors who look it up, if they want to counsel their patient, the patient's like, yeah, I'm not using free weights because I'm going to get injured.
Wow.
And the doctor doesn't know how to talk about injury. So, yeah, why don't you try this other one, right?
Yeah.
So you have to be flexible with this stuff, get the buy-in where you can, figure out where people are, break down barriers. It's not easy, right? So, yeah.
Yeah, I mean, I think that, again, depending on which population you're talking about as far as getting them involved, you have to figure out the barriers, and then what are the incentives to get them to change behaviors. And a lot of that has to do with their own social structure. Mm-hmm. If they don't know anybody who's gone to the gym, who trains or whatever, the idea that you're going to get them in and they're going to stay with it is also low, in addition to just not wanting to change behaviors. I mean, one of the biggest benefits I think that's come out of CrossFit, besides the equipment industry, besides all these other people training, is that they have really shown that the social aspect of fitness is addictive and can help people stay with training for a much longer period of time than we'd otherwise expect. And I would like if that was transferred over to like traditional resistance training, but tough. I thought, it's funny, before I went into medical school, people were like, I owned a gym, or, helped run a gym that I had a partnership stake in, and I was educating all these other trainers, and life was good, Life was good. They said, why are you going to medical school? And I was like, I want to save the world. I want to save the world. They don't know. I want to save them. And then a few years later, I started realizing that, a lot of the world doesn't want to be saved. That's the unfortunate truth. And so I think that you have to dedicate your efforts towards people who want your help, who are willing to accept your help, and then you look for the right ways to help those other folks who you think that you're missing, right? So we are intentionally casting a wide net. We are intentionally are not as hard-lined about you must do it this way. This is the only way it can be done. This is, our method, because we don't want to exclude anybody. If I have a person who I'm coaching and they end up squatting high the entire time that they're with me, but they otherwise wouldn't train, or if they didn't train with me, they wouldn't train at all, I'm okay with that. I sleep just fine at night, knowing that I'm helping them engage in regular physical activity with resistance training, and I get to interact with them on a regular basis to promote health. I'm okay with that. If I'm looking for perfection, right, you must squat below parallel, and it must be, while I would like that, I'm going to miss so many other people, and that's just not our goal. We want to reach as many people as possible, and that's why we're doing what we're doing. So.
Hello.
I feel like I need a hug after that, It's like, tell the rower bros. Bro. The question is, how do you strength train somebody who's an endurance athlete during season? My main thing is just maintenance strength. And so that being said, prior to the season starts, you should try to get a good accounting for how much time do you have, what are your training resources, because that's really what you're working within. And then after you have that, which is a set amount, you're doing the same sort of block assessment, program assessment that you're doing with somebody who's not an endurance athlete. Whatever proxy you're using for strength, how is that changing? If the estimated 1RM, for instance, is something we use, if that's staying the same week to week to week to week, I feel pretty good about that in season, in general. If it's like plummeting down, I'm like, well, either the other training stress is very, very high, or whatever I'm having them do is not even sufficient for maintenance. And I would expect that almost any training stress in the short term, like 2 to 3 weeks, would keep strength levels fairly normal.
Yeah.
And then even if it wasn't enough, I would tend to see a drop off after that. But if over the course of 8, 12, 15 weeks, I saw strength levels stay about the same, then that'd be good.
Yeah. We get asked about strength maintenance actually fairly often, and I think it's worth discussing just to point out that I think that the amount of training that's required for strength maintenance is going to be dependent on someone's training sensitivity, just like we talked about this in all these other contexts. So your example was somebody on the far right end of the spectrum, super training sensitive, respond really robustly to a given dose of stress. They probably don't need all that much to maintain their strength. And so if they're in season and we don't care about pushing their numbers up as high as they can, then they might not need all that much to maintain, right?
Yeah.
Conversely, somebody on the low end of the spectrum, for various reasons. Yeah.
I'm just saying maintain for a short period of time, a relatively
Short
finite
to
period of time.
moderate, yeah.
If you're like, I want to maintain my strength for the next 15 years and only train once a week, like,
No.
Nope,
Yeah.
not going to work.
But for somebody who's training resistant on the other end, either a young person who's training resistant or somebody who's older, frail, sick, they detrain quicker because they're more training resistant. And so they're going to need more work to maintain their strength compared to somebody who's very training sensitive. Yeah. And training for maintenance in that situation, in the long term, ends up in regression.
Yeah.
Yeah.
Because they may not have enough resources to actually accommodate that.
And the increasingly strong pull of anabolic resistance on them as they get older and older, right? It's pulling them down more and more.
Yeah. Probably what you're seeing at a high level and high level athletes is some training sensitivity that's allowing them to maintain high levels of strength during sport season, right? At the highest levels. And then that probably goes down as you get lower in competition level. Yeah. Question is, how would you manage a elite level CrossFitter's training? ? You're talking about just training in general?
That's like an enormous question.
Well, all right, but don't worry, bro. I got this.
Okay.
So nobody knows how to train for CrossFit. Well, we don't, right? Because nobody is pumping out CrossFit athletes who were previously untrained or previously not high-level CrossFitters. What they've done is say, oh, hey, you're a really good CrossFitter. You're going to come stay in this area of our country, and you're going to train with us and then go perform well like you did before. All the high-level coaches agree that you need a good strength base, which is biased towards Olympic weightlifting because that's a highly tested skill. They know you need gymnastics development, right? They know you need regular exposure to monostructural cardiovascular pieces. So you got to run, you got to row, you got to erg, you got to be good at all that stuff. Swim, sure. And then you have to practice your sport-specific training. Do you remember when people on the internet were saying, yeah, you just get really, really strong, and then January before the Open, you start doing WODs again. That's how you would get good at CrossFit. Nobody who makes the games is doing that. Like just, which may be a hint that that's a ridiculous statement. That being said, the dose amounts of each one of those elements is not only going to be specific for each individual athlete, but each individual coach has their own sort of spin on that. So if you're asking me how I would manage a high-level CrossFit athlete's training, it's going to be dependent on that athlete. What are their needs? Now, my overall view of sports performance and how to develop that, how to extract all of the potential in athletics from an individual is what are their strengths, what are the weaknesses, keep their strengths as high as possible, and try to put Band-Aids over their weaknesses, which people on the internet are saying, what? No, you got to work on the weaknesses, man. I heard that in high school where I used to play football. That's not what I think. I think that whatever your strengths are that have made you successful, right, that gave you a competitive advantage that's gotten you to where you're at this point. Let's leverage that. For instance, one elite level CrossFitter who I'm thinking about right now used to be the strongest person in the field, all right? And that was her competitive advantage. She was the strongest person in the field, great gymnastics, but whenever there was anything that had strength related at all, she'd crush everyone. Now she's no longer the strongest person in the field. She's markedly improved her endurance, but her overall, and she's about average strength in the field. Her overall performance level has decreased significantly. The idea that you're bringing up your weaknesses, all right, and that's going to make you more competitive doesn't work in a sort of winner-take-all competition setting. CrossFit rewards folks who get first, second, third at whatever stage of the game, and then if you get the difference between 35th and 40th, it doesn't matter, right? That's still bad. So you would rather have some things that you have the potential to win, right? And then if you happen to, be towards the bottom of the field, it's not worth improving. Doesn't mean you don't have to work on it. It just means that don't make your strengths less strong than they already are. The other thing I would say, if you are not an elite level CrossFitter, meaning that in your second year of CrossFit training you haven't made it to regionals, then you should quit CrossFit. Well, because you're not going to go anywhere in CrossFit. It's just not going to happen. And you could live a full and complete life doing other stuff. And, that's what I would do. Well, I got 1,999th in our region during my CrossFit experiment. So sick. Yeah, well, I was 1,998 behind Ben Smith, and I think that we were pretty close on some things. And I think if you ask him, he'll say the same. He'd say, that boy was good on those deadlifts. But I realized, half a workout into the Open that year, that I was never going to be a good CrossFitter, no matter how hard I trained. It wasn't just if you work hard enough, things are going to happen for you. That's not the case. You have to have a certain level of fitness and genetic development and genetic traits that are already there, raw, right? And then you get exposed to CrossFit and you say, hey, I'm actually pretty good at this. And it identifies the athletes. Selected. It doesn't develop the athletic traits needed to go win the games. It identifies the people. That's why nobody who was started in CrossFit, nobody who's born in CrossFit has ever won the CrossFit Games. These are all athletes from other sports, right? The only person that they could potentially argue is Lauren Fisher, but she played a bunch of high school sports as well. So how would I manage their training depends on the person. I think that inappropriately biasing their training towards strength work I think that would be inappropriate unless the person was really, really strong, in which case I would keep that, their strength. Just as a last sort of thing, Brooke Wells pulled 415 for a triple. Yeah. So we have some work to do. Who's going to win here's the question to the group. Who's going to win the CrossFit Total this year? It's in the games. It's a games event. Somebody say Frazier? Wrong. This guy. I'm obviously going to win. Silly. All right, so thanks for watching. Make sure to stay tuned for part 2. That's going to be released next week. If you dug the video, hit like, subscribe for all the latest content. We'll catch you guys next time. See you.